Superstitious.
Me too. Now I'm neurotic.
I know, me too. I'm
I was
neurotic.
so relaxed a minute ago. It's just
I know, I'm sorry. Hi everyone who doesn't know me. I'm Cortlyn Jeter. I'm one of the attendings at Mount Sinai Hospital, assistant clinical professor.
And I'm Pedro Giron, and my ID says assistant professor too, but I'm actually just clinical. So already I'm starting with that imposter kind of ID. But
You both have talked about imposter syndrome and things like that before. Why do you both feel that way?
I don't know. I feel that way about a lot of things. I mean, to me, I'm just always Cortlyn. Not Dr. Jeter. I'm not Cortlyn who does different things, photography, artwork, things like that. The Cortlyn who travels. I'm always just Cortlyn. And I never really liked titles. And, your parents used to say, my daughter a doctor? At least my mother, my father, he was more like me. And so that's why whenever I'm doing something, I just feel like I'm just Cortlyn, and just being Cortlyn, it's not anything special that no one else hasn't done.
God, you said that so brilliantly. No, I feel the same way. I mean, when I'm not in the hospital, I don't feel that my primary identity is a doctor. So it's always jarring to me to step into the hospital and realize, oh yeah, I am the doctor. And so it takes me a while to adjust to that, and then to recognize, yeah, I do have like competency, and I can do this, but it really every time is, I have to remind myself. Sometimes I'll do a little warm up and listen to an MRAP tape on the way to work or something, just to kind of remind myself. But
yeah, I just always feel like, I don't know, it's not feeling like you're less than other people. It's just feeling like, I guess because I was really never in academic medicine, I've always been sort of a community doc. And when I got out of med school, and the reason why I went to med school was to take care of people, is really simple. It was just going into med school to become a doctor, to take care of people. I didn't want to be this famous or infamous cardiologist, neurologist, gastroenterologist, ER doc. I didn't even know I wanted to be an ER doc. That was a whole nother different story. But, I did internal medicine first, and I kind of just did it because it was a hodgepodge of everything. And don't get me wrong, I was thrilled to graduate, med school, but I wasn't at the top of my class. I was in the middle, like everybody else. Just graduated, got my degree, and did my first residency, did my second residency, and worked in urgent care centers. And what else did I do? Mostly urgent care centers, as well as my regular jobs, when I was still an internist at Robert Wood, and then also as a house physician. So I never went the track of sort of doing what I felt that some people do, and I really admire. And I'm like, gee, I wish I could have done that, but I just didn't, because it wasn't me. And I just went and became a doc, first an internist and an ER doc, and that's about it. And I still look at it that way, even though I admire people who took another route and are making, major publications and are on television and doing all these other things. But I'm just a regular old doc.
Pedro, how did you end up in this path?
Well, first of all, I just said MRAP tape, which totally dated me. It was like, now people are picturing me like, oh, there's an old geezer pulling out his cassette tape thing and putting in like an old 1990s MRAP thing from. That's why he doesn't know. No, anyway. What was the question again?
This path to emergency medicine.
This one, no, you know. No, I mean, I just like you, I went to met my dad was a doctor. He was a vascular surgeon, and and he was in academics, but also was on call every third night. Was up all every third night. You know, worked super hard. Loved what he did, and I was just like, I could never do that. And then when I graduated college, I thought, well, actually, I don't have a creative bone in my body. I haven't had an original idea, and I'm no good at math, so maybe I should go to medical school. So, but I was definitely middle of the class and graduated, and I was like, phew. And then I thought, now I have to do surgery because I just thought that would be my path. And I did surgery first and second year at what used to be St. Luke's, and that was Morningside, and it was a trauma center. Heroin was big, but now crack hit, and crack gangs were shooting each other in the face and the groin, and so it was huge trauma. And there were no residency protection laws, so the on-call schedule was every other night call. So every other night you were up all night with these trauma cases. I would fall asleep standing up in the subway and go do it again. And it was just so brutal. And after 2 years, I was flunking on the in-service, and so had to reconsider, did a third year of that, and then said, okay, enough. And then took a couple of years to try different things. And one of them, which was most formative, I think, was going to work in South Africa during apartheid with Doctors Without Borders. Thinking, I trained in surgery, I can handle anything. And the fact is that, 3 years of general surgery residency teaches you how to do a lot of scut and wound dressing changes. And that's when I realized, really want to do global international medicine. This is really cool. What's the best specialty for that? And the coolest people I met were actually in emergency medicine. And so I got into Lincoln and did the training there. And that's, how I wound up doing what I do.
Wow.
But it was definitely a process like yours of kind of trying some different things first and having some perspective and background. And
yeah, because when I graduated med school, no one was doing emergency medicine for a residency. Absolutely no one. It wasn't even a thought. And everyone was doing something else. So of course I didn't think about it. And like I said, I went into internal medicine not for any great love of internal medicine. Like some people, I felt kind of bad because a lot of med students were like, oh, I want to be a surgeon. I want to be gastroenterologist. That was big then. I want to be ophthalmologist, all kinds of stuff. I didn't feel that way. I said, you know what? I'll be an internist and, sort of a hodgepodge of everything. And maybe I'll find my niche in some subspecialty. And then, actually my second year of internal medicine, I left, and I was doing fine, but I just left. And I thought I wanted to be a pathologist because I always loved, I know it sounds silly, but the gauge of figuring things out, almost sort of being a sleuth. I just love that. And I thought that pathology would, be an addition to that with medicine. That didn't work out because I went to NYU. I got a pathology residency at NYU, and I was there 10 weeks. And I was getting vertigo from looking in the microscope. I was nauseous. I could not stand getting pieces of people from the pathology lab and putting them in a cassette. That's when I figured out that I was too social for pathology. And I walked right back into my internal medicine residency, third year, right into a unit month.
Wow.
But I was never so happy to be there. And then, I kind of, I finished, and like I said, I worked as an internist and kind of dropped into emergency medicine because I just happened to call to just get an application. Back then you called and did fax. There was none of this computer stuff. And Maggie, who was Dr. Lynn Richardson's residency coordinator, was at work at 10 o'clock at night. And I called her, we connected, we spoke for an hour.
Wow.
And she said, Cortlyn, just send me your info. I'll put it right in front of Dr. Richardson's desk. And she did. And then a few months later, outside the match, Dr. Richardson called me. And here I stand, or sit. I know. So we both dropped into emergency medicine in strange ways.
And who was Maggie? She was the assistant to Dr. Richardson?
Yeah.
She wasn't an MD or anything?
Mm-mm.
Yeah, because I think that's...
Yeah, Maggie Rodriguez.
Yeah, there's one piece of advice for graduating residents is to appeal to who the person who's got the desk job. Like that's the person who's going to get you into the program.
Yes.
Like all my jobs have been really by brown nosing or schmoozing with like that first person who picks up the phone to make appointments and things like that.
Yeah,
not the
it
head of the
is.
department or
It
anything
works.
else. Yeah. Oh my gosh.
It works. And I had no idea how well. And just like I said, 10 o'clock at night, Maggie's working late, random call.
Yeah, that's so
Boom.
wild.
One of the things that at least the residents admire so much about you both is that it's not just the coordinators, but you both are so kind and graceful to everybody you meet. And everybody in the emergency department, every single patient, every single staff member, you really create a culture of appreciation and unity. Where did that come from? Have you both always been this way? Have you seen this in other places?
No, I've always been this way. The thing is that you never know what's going to happen to you in life. I mean, we see the homeless people. We see people in all these different kinds of situations. You never know where you're going to end up. And you never know who's going to have to help you. And I was raised that way by both my mom and dad, just our family in general. And, you never look down on any other human being. I don't even look down on a plant or a flower, I'm even, nice to the ants. I don't step on them or anything. No, but seriously, that's just the way I've always been. That's just me. Like I said, Cortlyn.
Yeah, I can see that's comes naturally to you, but not to me. My gosh. No, you're incredible. For me, it's not in my nature. It just came from thinking about what is it I love about emergency medicine in particular, and what is going to help me actually drag myself into that place to go to work. And if you're not loving the people you work with, then it's a totally burnout job. So I think it's almost self-serving to be kind of nice to everyone, or if you can't be, to figure out a way to be, particularly to patients who are, have the personality disorder and who smell horrific and all the rest, to kind of like overcome all of that and figure out, I'm a professional and this is my, choosing. I'm here because I want to be, and how do I interact with that person in the friendliest, positive way? Because like that, I don't really find being oppositional or controversial or being overly dogmatic with people like that is helpful to either myself or whoever you're dealing with.
That's very true. That's very true.
I mean, you also brought up a component of burnout. This is not an easy place to work. It can oftentimes be very stressful. How have you been able to find joy, take care of yourself, stay centered?
I wish I could say pastels, but that's
basically, I just never forget the reason why you do what you do. I think what happens over time and in life, with everything that happens in life, all the situations, so many things, that you forget, why you do certain things. So in this respect, we're talking about career, we're talking about emergency medicine. Again, I went into this basically because I wanted to, because I wanted to find a way. I'm not very, I'm not altruistic about it, but I wanted to find a way to connect medicine and science. And those were, that was my bottom line, even, back then, and still stands today. But I'm not burned out, because at the end of the day, it's still my job. I get paid for this, I'm not coming in like voluntarily, we get paid for this. And so we went to school for this. And this is your job. This is your occupation, whatever you want to call it. This is your calling, whichever way you see it in your brain, this is your job and you have a job to do. And so anything that happens on the job, I guess I can compartmentalize pretty well. This is Cortlyn here. This is Cortlyn here. This is Dr. Jeter here. This is, so on and so forth. I think you have to be able to compartmentalize, because what I always tell people, when people are yelling at you, spitting at you, cursing at you, all the bad things that can happen in the emergency department in terms of things to you. You don't live with these people. I mean, they're not, hopefully they're not in your house. They're not in your house. And when I walk out that door, whether or not it's St. Joe's or wherever, when I walk out the door, that stuff gets left behind. Of course you think about stuff, in terms of, did I take care of that patient this way, that way? I hope we all do, because we should. But as far as any of the stuff that really causes burnout, I don't carry that with me. Plus, there's so many other things I enjoy doing in life, like my pastels, like my photography, like my tap dancing. You can't forget.
Tap dancing?
Yes, yeah. You can't forget, and get overwhelmed in any job, because I've seen it. I've almost married workaholics, So it's it can become all consuming, can ruin not only your life, your family's life. I mean, it can get bad. And so my job for me is to make sure that I live a full life, and I'm not just Dr. Jeter, but that I remain Cortlyn.
I don't even know how to follow that. That was so thorough. That was my answer. That's my answer.
Do you also feel that being balanced and diversifying and doing other things are important?
Yeah, absolutely. Like, I think the beauty of emergency medicine is that it's always factored in free time. I mean, that's, other specialties poo-poo the idea of shift work, and but the fact is that because of shift work, so-called, it also means you can compartmentalize your life, as you said, and have this free time, and the key to that is filling it with things that are fun and that you look forward to doing. And so when you're at the depth of your misery and then the busy shift and the ED, you think, well, actually, this is going to end in a few hours, and then I'm going to be able to do this thing that I love to do. And so I'm a dilettante, and I have lots of hobbies, all of which I do terribly, but I love them, and that's, I mean, this sounds so hokey, but I mean, this, now there's all this science about what is happiness, and however you want to define happiness. And I think this super bright friend of mine is writing a whole book on happiness. And I just, what's it going to be about? It's going to be the science and sunlight and seeing, dawn and dusk. Says, no, just happiness really is really intimately tied to having a meaningful life. And like, to me, you have to kind of really think about it and be conscious of it, but you have such a special job as an emergency physician. I mean, it's so deeply meaningful to the people you interact with. You provide tons of charity care, though you don't really see it, but as a salaried physician, you're doing so much work for free that other specialties don't recognize. And you're impacting people in amazing ways. And so, once you think about that a bit and think about why you're there and what an actual privilege it is, despite the fact it took so long to get there with all the training. And well, let's put it this way, it really kind of makes you think about what can I do to prevent from burning out, because I really am in a special place, in a special position.
Yeah, and I think a lot of people forget, especially residents, you can get so tied to, any residency, not just emergency medicine, what you're doing, that, you forget how to live. You forget how to live. And that's the bottom line of why we're all on this planet. You have to live.
Yeah.
So to wrap up, one final question is one piece of advice you would want to give residents, new attendings, faculty, things that you've learned that you'd wish to pass on to them.
I guess the last thing I can really say is always just be yourself. I think one of the thoughts you have to really concentrate on before you go into residency, and then just never forget it if you don't know it already, is to always remember who you are. Everybody's got a core personality, whether you're not a good person, bad person, or whatever you got, but just to, remain stable, stabilized in that, and try to build onto it positively, not negatively, because it's easy to do the negative thing. You just have to remember to try to always be positive, be grounded. And I know a lot of people aren't religious, but I'm also religious. I don't, go professing it anywhere to anybody, because everybody's got their own thing. But that also keeps me grounded too. And so just remember who you are. Don't forget your core beliefs, your core positive beliefs. And that's about it. And I think that takes you through, throughout life. It doesn't matter whether or not you're going into medicine, going into business, or just hanging out on the street, And so that's the bottom line. That's my advice.
That's real. I'm going to take that advice.
Yeah.
Wow. I don't know how to top that. I mean, I can't. I think it's just following on the burnout thing is don't let yourself burn out. There's so many ways to avoid burnout. You just have to kind of think about, what is it that's really kind of killing me here? Am I working too much? Is it the schedule? Is it the people I'm working with? Is it the environment of care? Emergency medicine offers so many different types of practices. It's incredible. Mount Sinai is the most challenging place I've ever worked by far. It's not reality. It's not the real world. Residents should recognize that they're getting amazing training for 4 years, and it's really incredibly difficult, but it's incredibly varied between Elmhurst and Sinai. You're seeing about everything you're going to see out there in the world. You're ready for anything. And so that means that you have enormous opportunities to find the kind of life that you want, and you'll find it. I didn't know I was going to wind up in Hawaii for 15 years after I trained in the South Bronx, and when it was the murder capital of the world. And I wound up for 15 years going to work, then surfing after work, or windsurfing in big waves, or mountain biking, traveling. Yeah, had a tractor and a farm. It was, you can do anything you want in emergency medicine, so don't let yourself burn out in residency. There's no reason to. There's so much support.
Yeah, there's
now.
no reason to do it.
There's so much recognition of
Wellness.
what the factors are that causes it. And it's funny because one of the most impressive people I've met in residency here is there are two people. Kevin, who was unbelievable, and Stephanie Hernandez is just so smart, so efficient, so energetic about what she does, and then has this other life. And they're both opposites. They're
Right.
And so it's just to say that there's
so many different.
There's so many role models
and
cool
right.
people in emergency medicine, and
Well, you both mentioned role models, and you two definitely are role models for us. So
Thank
you
you.
again. Thank you for
I
spending time
appreciate
with
that.
us. We'll see you back in Chip.
All right. Bye, Charles. We love you.
try to do the best.
Sorry, guys.
Hi, Neha.
I gotta run to work.
How are